Hi, my name is Dr. Majid Fotuhi. Today I want to talk to you about the magic of sleep. Sleep is so critical for optimal brain function that I talk about it with all my patients. When you sleep well, you feel well, you learn well, and you enjoy your interactions with others. And when you don't sleep well, you're grumpy and you can't concentrate, and you go through your day feeling frustrated. Now, does not getting enough sleep have long-term complications? Yes, absolutely. If you sleep fewer than 6 hours a night, you are at a much higher risk of developing strokes, and your brain shrinks every year you don't get enough sleep. So if you have not had enough sleep for 2 years, your brain shrinks by this much. And if you have not had enough sleep for 20 years, your brain shrinks by this much. How this happens is still under investigation, but we think that high cortisol levels, which happen with lack of sleep, are toxic to the part of the brain for memory, which is hippocampus, and that's why the brain shrinks with lack of sleep. Another factor that's really bad for the brain is sleep apnea. This is a condition in which people snore at night and feel groggy during the day. A lot of people joke about snoring, and it's not funny at all. It's actually a major risk factor for strokes and heart attacks. And people have a smaller brain the longer they've had sleep apnea. So just like insomnia, sleep apnea is really bad for your brain. Fortunately, there are good solutions for both of these conditions. They're both rather easily treatable. With insomnia, you need to establish the cause of why it is that you can't sleep at night. For most people, anxiety, repetitive negative thoughts, and worrying about deadlines or other major life issues contribute to difficulty falling asleep or staying asleep. If worrying about things keeps you up at night, you need to do something about it. What you need to do is make a list of the issues and the problems and make a specific plan as what it is that you will do about them in the next 90 days and in the next 2 years. You need to appreciate that everyone has problems in their lives and you're not alone, and you just have to be able to handle the issues, and you have to be understanding of the fact that your power on getting things is limited, so don't expect a lot with your situations. Once you have a plan of how things are going to work out, then you can have an easier time falling asleep. Poor sleep hygiene is another major common factor for insomnia. For example, if you drink coffee in the afternoon, if you spend too much time on your phone, if you exercise and work in your bedroom, if the dogs keep you up at night, these are common factors that prevent people from sleeping well at night. You have to appreciate that your sleep is important, and if you have any of those risk factors, you need to do something about them. For example, do not drink caffeinated medications, and don't take drugs that may keep you up at night, such as Adderall, after 12 noon. Also, put away your electronics at least 2 hours before bedtime. Do not do vigorous exercise in the evening. And in your bedroom, there are only two things you need to do: sleep and read, and of course, sex. Do not bring your laptop or computer to your bedroom, and do not bring exercise equipment in your bedroom. If you do all those things, you should be able to improve your insomnia. If you still have difficulty sleeping, you can see specialists who do cognitive behavior therapy. This is a way of teaching you on how to make a schedule for your sleep and improve that schedule over time. Cognitive behavior therapy is really successful, and I strongly recommend it to all my patients. The treatment of sleep apnea is easy. You speak with a sleep specialist who do a testing to establish the severity of sleep apnea, and then you receive treatment with machines such as CPAP or newer devices which do not include a hose, such as Inspire. Of course, weight loss and treatment of obesity is a cure for sleep apnea. Once you lose the extra weight, you will not have any obstruction in your airways, and should be able to sleep well. In summary, sleep is really critical if you want to have a sharp brain and if you want to have a long life. And so if you have insomnia or sleep apnea, please do something about it. Thank you.